have used client cases teaching pharmacology and teaching pediatric nursing. And I absolutely love it. And any class that I ever teach, I will use this product. But I want to speak to faculty about using this product as an integral part of the entire curriculum. So I really believe that connecting cases immediately into nursing school makes sense. Students are getting their BSN, all of their nursing content in 1 year if they're accelerated, or 2 years if they are a more traditional nursing program. That's not a very long time for them to get and to use and to practice the tools that they need. And our goal as educators is not just to get them to pass the NCLEX. They have to do that to become a nurse. But I'm passionate about nursing, and I do this work because I want to change health outcomes. I want health equity. I want to see outcomes change in healthcare. I want us to have a diverse set of nurses that reflect our population, that it is still a white profession, and that isn't helping all the people. So how do we do this? So my goal as a faculty is to make my students practice ready. So not just to have them learn in the classroom, but I want them to be ready to do what they're going to be doing in practice. And we know what nurses are doing as brand new nurses in every practice setting is they're making clinical judgments. And making clinical judgments requires that you have quite a lot of knowledge, and then you have a skill base for clinical judgment. And the way to do that is to have complex patients from the very first class. So the strategies on that, and I use these in teaching pharmacology. So we're talking about pharmacokinetics, and I'm talking about how drugs move through the body. So then I just bring up a patient, okay, what jumps out to you about this patient? What do you think might not be right? And then we would go to their labs, and we have some labs, and we happen to have some labs about kidney function. So right there, I'm showing the students, okay, here's their kidney function. What do you think? Do we need to be worried about their kidney function in terms of meds? Because almost all our medications are eliminated. So you're just always taking content and showing how it's going to show up to the patients. And I'm going to talk about this again because one of my early things is that we're teaching this content. We're doing this lecture-heavy PowerPoint thing. And then when students go into the simulation or they go into the clinical, they're just like this patient doesn't look like the PowerPoint. And I have no idea what to do. So we're thinking about patients from the very beginning.